Welcome back. November is National Diabetes Month, and diabetes can affect a number of important organs in your body. One of them is your eyes. Our medical contributor, Dr. Ogechika Alozie with Sunset West Health, is here to talk about diabetic eye disease.
Yes, sir.
Dr. Alozie, how many people in the U.S. have diabetes?
Well, there's a range. So there's about 96 million that have diabetes, but the issue is not the raw number. It's actually 96 that have prediabetes, 37 have diabetes. The problem with that number is that about 1 in 5 of them, or 20%, don't even know they're diabetic. And you can imagine the complications of diabetes, one of them that we'll talk about, and not even knowing. The worst part is those that have prediabetes, almost 100 million, 8 out of 10 of them don't know. And for me, that's the scary part, because that's preventable and you can stop progression early.
All right, now let's talk specifically about diabetic retinopathy. Easy for me to say.
Mouthful.
Yes, doesn't have early symptoms, right?
It does not. So one of the problems as well is that you see this graphic and it's going from 9.6 all the way to 14.5 projected in 2050, and you may say, wow, that's a huge growth. Well, part of it is that people are getting older, right? And diabetes and the complications of diabetes worsen as you get older. So as the baby boomers get older, I'm a Gen Xer, I'm getting older, people coming below me are getting older, more people are developing diabetic retinopathy.
So how do you protect your vision from diabetes?
Well, I think part of what you said is that there are no early symptoms. People just assume I need glasses. People with diabetes just assume, well, I'm getting older, I have diabetes, and it doesn't matter whether you have diabetes type 1 or type 2. The reality is that there's a lot of things you need to do. Track is a nice eponym for you to sort of look at, but I think one of the things to talk about as well is you got to know you have diabetes and you got to keep on track, right? So it's taking your medications, reaching and maintaining a healthy weight, staying physically active, knowing your A1C. We've talked about A1C a host of times, and it's always frustrating and surprising to me, and that comes back to health literacy that we talked about a few weeks ago, how many people don't know their A1C, and of course smoking, because that affects the small vessels of the eyes.
And if you're not seeing an eye doctor on a regular basis, which you should do once a year at least, how about some other local resources here in addition to your own eye doctor?
Yeah, again, so there's a host of resources, whether it's diabetes and endocrinology specialists of El Paso, whether it's the eye specialist, the LASIK, Center for Diabetes. Again, I think the key for me is this. As you get older, and we talk about this often, get in touch with your health. Understand, am I diabetic? Am I pre-diabetic? What are the things I need to do to prevent becoming diabetic? And once you're diabetic, you need that eye exam, and it should actually be once to twice a year. Get glasses, prevent losing your sight. Your eyes are beautiful, and you need them to see.
Absolutely. ABC-7 medical contributor Dr. Ogechika Alozie will see you next week.
I like that play on words.